New coronavirus cases in India are at a near one-month low. Just over 75,000 fresh coronavirus cases have been reported, down sharply from the average of about 90,000 daily cases this month. The government says India also has one of the world's highest recovery rates at about 80%. More than 100,000 patients have recovered from COVID-19 in the past 24 hours, which is a new record. Now, for more on this, Ishan Garg joins us live from New Delhi. Ishan, is this a sign that the situation in India could be perhaps turning a corner?
Well, as much as people in India would like to believe that that's the case and that we have hit a point here in India that the cases of coronavirus are starting to get lower and lower, but unfortunately that's not the case according to many experts. What seems to have happened here is that the testing numbers have gone down by about 20%, which is why we are also seeing a reduction in cases of close to 20%. Just a few days ago, we were seeing cases close to 95,000, 97,000 on a daily basis, and now the government has reduced testing by a 20% margin. That's why we are seeing a reduction in positivity rate as well. And so it would not be fair to say that we are coming to a position where cases are reducing, because the serological surveys that have been conducted in India in the past few weeks indicate that the prevalence of antibodies of COVID-19 is way higher than the number of people who have actually tested positive for COVID-19, clearly indicating that the virus is a lot more prevalent than what we are assuming it to be right now. Now, there's another nationwide survey that's being conducted, and when the results of that come in, we will have a much clearer idea of how bad the pandemic has spread all across the country. But for now, the government hasn't really offered any reason as to why the testing has been cut. But several experts and opposition party members alike are saying that it's because the government wants to save face. For the past few days, we were seeing numbers as high as 95,000, and if that was the rate of the growth of infections, India would have overtaken the United States in the next few weeks, and that might have led the government of India to not look so good, which is why experts are saying that the testing numbers might have been reduced, but we will have a clearer picture of how bad the infection is once the results of the new pan-India serological surveys are in.
Ishan, several vaccines are in the final stages of trials right now in India, and Prime Minister Modi has promised everybody's going to get one when it appears, but implementation is going to be a challenge, isn't it?
Absolutely. I mean, just considering the number of people that need to be vaccinated, I've been speaking to experts who say that given the strength of the vaccine and its efficacy, the number of people who need to be vaccinated for the entire country to be declared pandemic proof could be in the high 70s or even the high 80s. So we are looking at vaccinating close to 1 billion people. That's a massive number in itself. And there are so many challenges to actually delivering the vaccine, not only to this massive area that is India, but also to the very corners of the country where there's no transport available, where people don't have access to basic medical healthcare infrastructure. So several experts are saying that the time that India is taking to develop a vaccine, it should actually start preparing the basic infrastructure. So, for example, it should start hiring more healthcare workers, or they could be on a temporary basis, but more healthcare workers could help the vaccine reach people who are far away from the formal healthcare sector, and also to sort of build a confidence in a vaccine, because there are several people who have some ill-conceived beliefs about vaccine. They don't trust the government, they don't trust modern medicine. So that's going to be another exercise. And on top of that, we are talking logistics, we are talking about the cold storage facilities, we are talking about physical vehicles which are going to transport these vaccines. Now, a Prime Minister has said that each and every person in India will be vaccinated, and a plan for that is already ready. So it's only going to be a matter of time to see if that's actually possible. But experts are also saying that India also has a history of vaccinating a large number of people when it ran the polio drive back in 1990. So that area there is showing us that it could be possible to vaccinate such a large number of people, but we will only know for sure once a vaccine does arrive.
Ishan, thank you very much for that. Ishan Garg there, reporting from New Delhi.